I want us to talk a little bit about the medical interview just because it's a very critical aspect of the encounter and really the clinical workup. This is the time that we have with the patient to ask them questions and figure out, in part, what's going on. And in today's day and age, this really is kind of being minimized to a large extent because we have so much testing available and so many other things in our arsenal. We really don't spend the same amount of time that perhaps previous generations did on actually talking with and spending time with the patient. In today's practice, it's not uncommon for patients to only be seen for anywhere from 5 to 30 minutes, and in some specialties, maybe you'll have an hour, but oftentimes it really is a very short amount of time. It's for this reason that we want to make sure we understand the philosophy of what we're actually trying to accomplish in the medical interview. And again, like some of the other videos on here, this is going to seem very, very simple, but in reality, it's surprising how quickly the core elements of something like the medical interview can become compromised. So as the patient comes to us and as we're going to be talking with the patient, a lot of our training in our preclinical years has prepared us for this moment, but has done it in a way that's very reliant upon checklists. There are lists of questions that we have to ask. There are lists of things that we want to get through. And not to say that that's not important. However, in the spirit of list making, we can miss the bigger picture. What I want to advocate for is that as you're doing your medical interview, you ask yourself a few questions and keep them in the back of your mind at all times. The first is, as you are asking questions, you should be asking yourself, why am I asking this? I understand that's a little bit of a confusing statement, but the point is you have to understand why you're going through the checklist. Why are you asking all the questions that you are in the interview? What are you hoping to learn from those questions? And related to that, I want you to also keep in mind, how does the answer change your clinical management? And also, if it doesn't, if the answer to a question does not change your clinical management, maybe you need to be asking yourself, why did I ask this? Why did I want to know the answer to a question that has no bearing on the clinical course of the patient? Now, thinking about the clinical management and the clinical course, those are very, very fluid and broad topics. So it's important to appreciate that not everything has to necessarily be directly related. However, if it's kind of a stretch, we'll just use something very benign. If you're talking about the shoe color that the patient is wearing, I'm sure someday someone could write a research paper that says patients with X color shoe have an increased incidence of X problem. And maybe someday that will be a risk factor. But for now, there are plenty of other questions that we should be asking before we get to something like shoe color. And we need to make sure that in our 15 minutes or in our 30-minute interview, we hit the more important questions first. Because truth be told, there are a lot of questions that we can ask. And in retrospect, we can justify asking them based upon certain research studies or certain analyses that were done. But in reality, when you're actually in the ranks with the patient, you can't do things in retrospect. You have to think prospectively, and you have to think about what questions you're asking, why you're asking them, how the answer to the question impacts the clinical course of the patient, and then ultimately when you conduct the interview, what you're going to be doing next.